Phlebotomy certification practice questions. Let's get started. What is the purpose of a control in quality control procedures? Is it A, it is a patient sample with known values to check instrument accuracy? Or B, it controls the speed of the centrifuge? Could it be C, it is used to control bleeding? Or lastly D, it is a log of daily activities? The correct answer is A. Here is why. Control materials have known, predetermined analyte concentrations. Running them alongside patient samples verifies the testing system is producing accurate and precise results. B. Centrifuge speed is set manually or electronically. C. Controlling bleeding is done with direct pressure. D. A log is a record, not a control material. Next question. An unconscious patient without an ID band arrives. How should they be identified? Is it A, ask the family member in the waiting room? Or B, use the name on the ER intake sheet and assign a temporary identifier? Could it be C, wait until they wake up? Or lastly D, use the name the ambulance crew provided? The correct answer is B. Here is why. For an unidentified patient, standard protocol is to assign a unique temporary identifier, e.g., John/Jane Doe with a number, and use that on all records and specimens until positive identification can be made. A. A family member's word cannot be solely relied upon for official identification in a medical setting. C. Delaying critical testing is unsafe. D. Ambulance information may be preliminary and should be verified through hospital protocols, not used as the sole source. Next question. The abbreviation NPO means. Is it A, new patient order? Or B, no problem observed? Could it be C, nothing by mouth, asterisk nil per OS asterisk? Or lastly D, not particularly odorous? The correct answer is C. Here is why. NPO is a standard medical abbreviation from the Latin nil per os, meaning nothing by mouth, typically for a period before surgery or tests. A, B, D, these are incorrect expansions. Next question. Which is an example of an engineering control to reduce needle stick injuries? Is it A, recapping needles carefully? Or B, using safety-engineered needles with retractable shields? Could it be C, wearing 2 pairs of gloves? Or lastly D, placing used needles on the bedside table? The correct answer is B. Here is why. Engineering controls are physical changes to the work environment or equipment that isolate or remove a hazard. Safety-engineered needles, e.g., self-sheathing, retractable, are a prime example. A. Recapping is a work practice control and is not recommended. C. PP is an administrative/work practice control. D. This is an unsafe practice that increases risk. Next question. A waived test under CLIA is. Is it A, a very complex test? Or B, a simple test with low risk of error, often performed at the bedside? Could it be C, a test that is always sent out? Or lastly D, a test that requires a pathologist? The correct answer is B. Here is why. The Clinical Laboratory Improvement Amendments, CLA, categorize tests based on complexity. Waived tests are simple, low-risk procedures that can be performed outside a traditional lab, e.g., glucose monitors, urine dipsticks. A. This describes high-complexity tests. C. Send-out tests are often moderate or high complexity. D. Pathologist review is for highly complex tests. Next question. If a patient refuses a blood draw, the phlebotomist should. Is it A, try to convince them it's necessary? Or B, draw the blood anyway if the doctor ordered it? Could it be C, notify the patient's nurse or supervisor and document the refusal? Or lastly D, ask a family member to hold the patient down? The correct answer is C. Here is why. A competent adult has the right to refuse any treatment. The phlebotomist must respect this, inform the appropriate care team member, and accurately document the refusal in the patient's record. A. While explaining the importance is okay, pressuring the patient is not appropriate. B. Drawing without consent is battery. D. This is assault and battery and is completely unethical and illegal. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.